Hello dear friends, this is a case of a 10-month-old female infant presenting with increased frequency of seizures, and CT scan was done for further evaluation. The CT scan finally was normal, no intracranial pathology was found, but however, as an incidental finding, opacification of the middle ears and the mastoid air cells was noted. Here in bone window, we can see the opacification of the mastoid air cells and the middle ears. Let's zoom in. Okay, so we all agree that there is opacification bilaterally. There is also opacification in the paranasal sinuses as well. So, as radiologists, how can we manage findings like this? According to the literature, incidental mastoid and sometimes middle ear opacification is a common radiologic finding and source of referral to otolaryngologists. Few studies have been published aiming to determine the rate of incidental mastoid opacification in pediatric population, to identify those with clinical mastoiditis, and to identify factors necessitating to otolaryngology consultation. In a large study, the results showed that the rate of mastoid opacification in children was approximately 15%. In children younger than 8 years of age, the mastoid opacification rate was 22%, and in children 8 to 17 years of age, the mastoid opacification rate was 6%. The mastoid opacification rate in male children is slightly higher compared to female children. There is no statistically significant higher rate of mastoid opacification during winter compared to summer. And another study states that the abnormal intensities in the mastoid cavity is considered to represent bone marrow in very young infants. Another interesting result from another study is that histopathological studies of the temporal bone and tympanometry investigations have reported the presence of mesenchymal tissue and liquid effusion in the middle ear cavities of infants. Another interesting finding, according to another study, is that all the abnormal imaging was appeared in infants under 1 year old, and in particular 75% of abnormal imaging appeared in the first 20 weeks after birth. So the conclusion is that although the overall rate of incidental mastoid opacification in the pediatric population is around 15%, it is rarely clinically significant. And clinical mastoiditis is very rare in general in case of incidental mastoid opacification. So we must take it into account when we find findings like this as incidental findings. Dear friends, if you find my videos interesting and tutorial, please subscribe to my channel so you will be noticed after I upload a new video. Thank you and see you the next time.